Good morning, everyone, and happy Monday. My name is Lily Tenney, and I'm the Director of HealthLinks and the Director of Outreach and Programs at the Center for Health, Work, and Environment. Thank you for joining us for our third town hall meeting, promoting mental health and resilience through COVID-19. The pandemic has impacted all of us and our work, and here at HealthLinks, we are committed to hosting these weekly webinars every Monday as an opportunity to connect us as individuals and as business leaders, to provide you with resources and tips. There's a lot that has been coming out and delivered as resources, and we're here to support you and your team in this together. HealthLinks is a program based at the Center for Health, Work, and Environment. We're one of 6 national centers of excellence for total worker health. Our mission is to advance the health, safety, and well-being of all workers. And we do this by partnering with employers, organizations of all shapes and sizes to provide assessment, certification, and one-on-one advising to individuals that are responsible for employee well-being and teams as well. Some general housekeeping before we jump into the presentation today. All participants are going to be put on mute and remain on mute through the duration of the presentation. So if you have questions that come up, please use the chat function and that's available in Zoom. And then what we're going to have is about a half an hour for Q&A and for discussion. And so we're hoping throughout the course of this presentation for you to ask your questions in the Q&A box in the control panel on your screen. This webinar is being recorded, and we'll be sending out a link to both the recording and to a PDF version of the slides, which our presenter so kindly offered to share with you all today. Well, we're also going to have a survey at the end of the webinar, which specifically is asking you what resources would be most helpful for you in the coming weeks and months. So please take a minute to complete that. It's only a few questions after the town hall today. So as I just described, we're going to have a short presentation by our presenter, Alex Yannacone, and then we'll open it up for discussion. And now it's my pleasure to introduce Alex, who has extensive background in implementation and trainings for prevention and intervention of mental health services in education. She is the Director of Education and Community Programs at the Helen and Arthur E. Johnson Depression Center at the University of Colorado, where she provides programs and trainings addressing mental health issues across Colorado and beyond. And she is also a master trainer in suicide prevention, including QPR and Working Minds. And when she's not working, she enjoys hiking and rock climbing with her husband, daughter, and dog. So it's my pleasure to introduce Alex today, who's joined us to present on this topic. Thank you, Alex, and I'll let you share your screen now.
Awesome. Thank you, Lily. Thanks for having me today. I'm going to go ahead and share. One second. Started on the wrong slide. All right. All right. Hi, everyone. So we will go ahead and get started on talking a little bit more about mental health resiliency through COVID. We'll do kind of a brief overview of this, what we can really do to support ourselves, support our families, support our coworkers or employees or employers, and then go through some resources as well to talk about what we can all do to become better informed or have useful tools. And then, as mentioned, we'll open this up for questions, anything that comes up. Hopefully, we can help guide you in the right way. So to get started, we know we have a range of responses and reactions to what is going on right now. We all kind of have different ways we're dealing with this, different ways it's coming up for us. But these are some of the common things that are coming up for a lot of us. We know there is a lot of fear, anxiety, and worry going on. One, just with our own health, how we are feeling, how things are going on with others as well, our family members, coworkers, people that we may feel like have been exposed that we're concerned about, and how their bodies or how they would be able to handle it. We also know this is having obviously a huge impact on our work. A lot of people unfortunately have had to be laid off or let go because of this. We're being creative in ways we're working from home or remotely. We also know there's essential workers that are still having to go to work every single day. And then we also know this is having an impact with basic needs. I think we've all seen the issues around just getting toilet paper. I went to go get chalk for my daughter the other day, and that was impossible anywhere online. So not necessarily a basic need, but we are seeing that this is having an impact on some of the things we're wanting, as we've seen in the grocery stores and some of the personal issues with getting personal care items. So a lot of kind of fears, anxieties, and worries in that sense. But we're also feeling really frustrated with the current situation. There's a lot of uncertainty of how long we're going to be in this situation, kind of what the future is going to hold for us. There's also a sense of loneliness. We're obviously very isolated. We're cut off from the world, from loved ones in a lot of instances, not able to see parents or family members or friends the way that we used to. So it can be really lonely in that sense. Anger has also come up. That's come up a lot with how others are taking in this information, not really taking it as seriously as they should. And so we get angry or upset with the way others are responding or what they're doing. There is a sense of boredom for a lot of people as well, because we're not able to do the things that we used to. We're not able to go to the gym or actually even just go into the office like we used to. We also are seeing an increase with drug and alcohol, some of that with boredom, some of it as a way to cope and deal with this huge change that we're dealing with. Also having a hard time sleeping because of the stress or anxiety that we have going on with it. And even physical health reactions where we're getting headaches or body aches or stomach pains because of the stressors that are coming on. So these are very normal responses that a lot of us are having right now. The thing we want to note about these that are concerning is, and where it can become more concerning, is if we're really noticing that this is becoming really persistent, a lot of these for 2 to 4 weeks or more, and it's really interfering with our ability to function and with our relationship. So we're just really pulling away, isolating ourselves even more than we are, and we're seeing this really large impact. That's where it may be more than just kind of these common responses and may have a bigger impact on our mental health. We also know this is having a big impact on our children as well. For those of you who have kids, these may be some of the things you're noticing. There may be more crying or irritability with younger kids. We also can see that kids kind of go backwards in their development a little bit with these big changes. So there's toileting accidents or bedwetting or a regression in their behaviors. Kids can be really worried about what's going on. This has been a huge shift. They can't go on playgrounds. They can't see their friends. So there's a lot of worriness or even sadness with them because of that massive change. We can also see there being unhealthy eating or sleeping habits, same with adults. I think a lot of us have noticed the way we've eaten has changed a lot, and we see that with kids as well. I can't imagine being a teenager right now and really the impact that has, especially if there's big life events coming up like sports or graduation. So obviously there's going to be irritability and even acting out behaviors, especially within our teenagers. We can have see in our children their difficulty with attention or concentration, some of that isolation and avoidance, especially of activities or things that they may really like to do or used to like to do, and we're seeing them not have that interest anymore. Same kind of issues with physical body issue or physical pains that may come up, and we may also see that increase in substance use as well. So again, these are responses and reactions that can happen, and you may notice in some of your kids, and some of them are normal reactions to some of these changes. But again, if we're seeing this be really consistent, not seeing any kind of positive habits forming and we're noticing that it's really impacting their day-to-day functioning, that may be a time that we want to seek kind of some more or some extra support around this. So what I want to do now, they're going to do a poll to rate really where is your stress level in regards to COVID right now. So I'll go ahead and have them, that should pop up in your screen, and just rate what your stress level is right now.
Looks like we've got a lot of responses coming in, so I'll just give it a minute. Okay, I'm gonna go ahead and share those results. Alex, can you see the results?
Yeah. So majority of people, over 60%, had the moderate stress, so right in the middle. About 24% high stress, 12% little stress, and then there's a few that are having the extreme stress, about 3%, and 1% no stress. So we're looking a lot kind of right there in the middle, which actually isn't bad. I think on a day-to-day basis, we tend to have moderate stress anyways, but around COVID, moderate stress is normal. Even some high stress around this is normal. So, we are going to have an increased stress, even anxieties and worry around that. And I think the important thing is to recognize that's normal. This is a huge change in what we're dealing with. And so there's obviously going to be stress around that, but that's great to note that we're all kind of feeling similar in this way. And hopefully we can help you all figure out ways that we can cope with the stress that is coming with this. So that's our next step, is how can we help with the stress that we are having, or mental health issues that may be coming up around this. So first line of focus is, how do I help myself? How can I really focus in on my own needs in dealing with this? I think we know this now, but this is a really, really important, is we absolutely need to limit our exposure to information and media. This is all that we are talking about. This is all that you're hearing about. This is constantly streaming and on every media outlet, every social media outlet there is, and it is extremely overwhelming. So it is really important that we set limits for ourselves on what we are looking at, how often we are looking at it, and really recognizing what an impact that has. So whether it's even setting a timer for yourself, or really recognizing how much did I check in on news today and how did that affect my mood? That is important things that we want to be recognizing and limiting, so that we don't feel so overwhelmed by all of this information coming in. With that, also really utilizing reputable media outlets, and we'll talk about what that is here in a little bit, or some options for that. You can look on anywhere and read an article on this, but it is really important that we're getting accurate facts and information. I'm sure a lot of parents are laughing at maintain routine, as you should be, because it does seem ridiculous, right? We are in an era where you are trying to juggle work and kids. Even if you don't have kids, you're just in a whole different world, and having a routine seems impossible right now. But it is important that we have some routine that does give us some sense of control. So I'm not saying that your 7 in the morning to 7 at night is going to be mapped out perfectly. We know that's not true. But we can do some things that are helpful to help maintain routine, whether that's taking a shower every morning, so paying attention to our hygiene, or having our cup of coffee at the same time in the morning, or having that phone call in the evening, or setting that block of time that I'm really going to be focusing on work. But having that routine, whatever that may look like, is important. And it's not going to be perfect, but routine really helps us feel in control, and also gives us, kind of helps with that stress and anxiety that comes up. Breathing and grounding exercises are extremely helpful, especially when it comes to anxiety. When we feel overwhelmed, this is a great tool to use to help us refocus, recenter, and kind of come to the present. So there's tons of opportunities to do this online. YouTube has millions of videos. The Calm app, Headspace app, There's a ton of apps out there that really can guide you through anywhere from 1 minute to 45-minute meditations or breathing exercises. But one that I think can be really helpful that you can utilize anytime and you don't have to follow anything is a really simple breathing exercise where you focus on your breath just for a moment to really bring you back to the center. So this is used a lot with anxiety. And what we want to do is when we breathe in through our nose and we breathe out through our mouth. But how we do this is important to bring us to that calm state. So one way to think of that is to think that you are breathing in the best smell, whether that's food, whatever it is, something that you love the smell of. You are taking a huge deep breath in through your nose of that. And then when you're breathing out, instead of letting out this huge breath, you're actually going to let out through your mouth as though you're blowing on hot soup. This is a great way to control our breath and really helps in that exercise. So I want everybody to practice really quick. I want you all to breathe in through your nose the best smelling food or flour or whatever it may be. Breathe in through your nose, a deep breath to smell that in. And now I want you to breathe out through your mouth as though you are blowing out on hot soup. So again, a simple tool that we can utilize anytime and really help with grounding or relaxing in that moment. We also, in this kind of era that we are in, tend to focus on what we can't control. What are my neighbors doing? Or, when is this going to end? Or what's happening, elsewhere in the world? Those aren't things that we can necessarily control right now. So we really want to try to focus on what we do have control over, what we have the opportunity to do things about. And I'll show you an example of that here in a little bit. It can also be helpful to do things that you're good at and support others with that. So when we help others, we know that also helps our own mindset. So whether it's donating, if we have the ability to do that, or cooking for others, or getting creative and making art projects or writing letters to people who maybe need that extra support right now. A resiliency plan is also really important. So planning for the future, we can feel really stuck right now, but plan for the future. Think of something that you want to accomplish when all of this passes, whether that's a vacation or getting more education or doing something with family or friends. What can that look like? Also thinking of what can I do to help friends and family in my community during this time. Making plans with others as well. And really, I think one of the most important things to recognize is we have all gotten through really hard times before, whether it's a divorce or losing a job or a transition in our life. We have gotten through hard times. So how did we get through those? What were our coping habits and strategies? How did we deal with that? We can utilize some of those same tools and really apply it to the current moment as well. We also want to get outside. We do still have the ability to get outside, whether that's on your patio or go on a walk, but getting fresh air is really important for us, not just being cooped up in the house all day. So even just taking a few breaks to step outside is really important. Self-care, I could spend an entire hour talking about self-care, but this is really important. So we're dealing with a lot of stress. It's important to pace yourself, do some fun things in between stressful activities, whether you're caring for your kids and then having a work meeting. Try to interject some fun things in there as well. Maintain a sense of hope and positive thinking, whether that's through journaling or right before you go to bed or when you wake up in the morning. Name 3 things you're grateful for. Have pop-ups on your phone of positive affirmations, or try to read positive affirmations on a daily basis. Read something enjoyable that has nothing to do with work or with COVID. Engage in fun art projects or listen to inspiring podcasts or music. All of those are things that really help with our self-care. And we have the ability to engage in those. Even if time isn't on our side and we're dealing with a lot, we can interject some of those throughout our day to help with our own self-care and those habits. I can't stress this enough, but connecting with others is extremely important right now. And thankfully, we live in a time where we can do that through FaceTime and Zoom and Google Hangout and all these different outlets and Skype. And so really finding ways to connect with others in a way that's meaningful. I've seen a lot of people doing parallel activities, whether it's they're playing games with each other, they're working out with each other, but it's all virtually. So thinking of things that you could do with people in that sense, and it can be a fun activity where you're still connecting with those that you care about. It's also important that we continue treatment. So despite the changes that are happening, it is important to keep up with treatment plans that you've been engaged in. So if you notice symptoms have changed and you need reassurance, a lot of providers are offering virtual visits. Mental health is growing, and I think something that a lot of people are utilizing right now. Making sure that medication refills are up to date. If you're concerned about running low, try to request from your provider to see if you can get approval for 60 or 90-day supply of medication. Also, just recognizing what warning signs may look like for you. So continue to monitor new or worsening symptoms you may be experiencing with either your own mental health or overall health and well-being in general. Do your best by using some of these things we just talked about to keep your stress levels low, really, especially during this unknown time of what's going on. For those of you who have kids, it can be also important to recognize what we can do to help them during this time. You can see Be a Role Model is bold, and that's for a reason. We are really showing our kids how to deal with this pandemic through our own actions and our own behaviors. So really recognizing you are a role model in this, and how we are reacting to it is how our kids are learning to react to it as well. So really taking that in, and we're not going to be perfect all the time, and that is okay, but we do want to recognize that that's going to have a big impact on them. We also want to reassure our kids and teens that they are safe. Let them know that it's okay if they feel upset. Share with them how you deal with stress and how you cope, so they can learn from that as well. It's also important to talk about this, especially if they have questions and if they're concerning. We can look things up together, or say, let's find out together. Try to find ways to help your kids find positive ways to express their feelings or emotions, whether that's fear or sadness. We know kids react in all different ways, especially to disruption. So it can be nice to engage in creative activities, whether that's playing or drawing or getting outside. So allowing them to express their feelings in a way that may be useful or helpful for them, that feels safe and supportive. There's a great document, and I'll point it out on the resource sheet, that really talks about how to have these different conversations with school age, middle school, and high school, how you can have conversations about COVID directly with them. Same thing that we want to do with ourselves. We want to limit our kids' exposure, our family's exposure to information. I know all rules with devices are kind of out the door right now, which is not a problem. But if your kid is only looking up COVID things online, we do want to limit that. We want them to understand, one, the facts and what the reality is around this. And if they're just looking things up on their own, it can be misinterpreted, it can be frightening, and we don't want to create more fear or issues around that. Same thing with routine. I know regular routines are totally disrupted because our kids are supposed to be in school, but have some kind of routine for them. Like, during these couple hours, we want to do a learning activity, or we're going to try to get outside once a day or twice a day. So have some routine in there, which can be really helpful for them to recognize that there's some consistency here. Even if it's not our old routines, create some new fun routines that can be helpful. Obviously, exercise, eating well, having fun, all of that's really important. Connecting, kids are now able to use Zoom to connect with classmates or grandparents, really trying to utilize those opportunities to do that. It can also be fun to identify projects that might help others. A lot of kids are trying to do this now, where they may be writing letters to neighbors or those who may be stuck home alone, or healthcare workers, sending positive messages. So just finding creative ways to support our community with our kids can be helpful. And then I think obviously we want to show lots of love and affection, not only for them, but for us as well. How we can help others during this time, especially if you're an employer or even with your fellow employees at an organization. common sense, but we want to treat others with kindness and respect. We are all in this together. So we don't want to be lashing out at how somebody may be reacting to this or behaving. Really trying to be kind, compassionate, empathetic is really important. Also recognizing that our routines are totally off. We used to see each other in most cases every day. We used to know how we all showed up. So this is really isolating. There's a lot of unknown, there's a lot of uncertainty. So this is even more the reason we need to be staying connected, not just through phone calls, but doing Zoom calls, seeing people face to face, not just checking in on work, but checking in, how are you doing with your family or by yourself? What's going on? How are you getting support? Those are important things to be doing right now to make sure that they have meaningful connection opportunities if they need those. Seeing how you can be helpful. I think one, we want to make sure they're set up okay to do this work outside. Do they have the physical setup, their computers or technology access to be able to connect and do the work? Again, making sure they have connections to others. And do we have the appropriate workload considered for what's going on? A lot of people are having kids at home or having, things that they usually do in person, trying to do it online. So not overloading with expectations during this very odd time. Also important to notice what that impact of isolation has. So checking in on them is important. We know loneliness can lead to further mental health issues. So be aware of significant changes that you may see in team members, their personality, the way, if a Zoom call seems really off, maybe even their productivity with work to a certain extent, if it's not due to, these changes that we're doing, but really seeing how they're doing and if you're noticing struggles. This also can be a time that we encourage that development piece. So whether that's encouraging them to sharpen skills through online trainings, it can be a good distraction for learning new things or having more opportunities in that sense. So if you have the opportunity to find trainings or learning opportunities, that can be really helpful. And then also making sure that we check in with the EAP or our health plans or insurance or providers. One, we just want to, figure out the availability, what changes may have happened, if any, during COVID. We want to remind our staff that there is an EAP, usually for some organizations. Make sure that's something you have that they can use to support and connect them with behavioral health support, connect them with health plans to learn what they're offering to support their members, and information that may come with that. There may be relevant web links and phone numbers as well. And I'm also going to go over some resources outside of EAP here in a little bit. So these were some of the things that I thought were helpful. There's a ton of these out, but I do love this one of what I can control and what I cannot control. So try to let go of these things that I can't control, like what other people are doing with their social distancing or predicting how long this will last or what's going to end up happening, and really focusing on what's my own positive attitude and how does that impact others? What am I doing to follow guidelines? How is my kindness and gratitude and compassion coming off? And how can I project that or let others know that I care about them and connect with them? Also, obviously, emphasizing self-care and just that connection piece. It also, the World Health Organization came out with some helpful guidelines as well, recognizing it's normal to feel stressed, sad, confused, scared. Try to have healthy habits or maintain those if you can. Really recognizing the facts, limiting your information that you're getting. And then both of these mention that resiliency piece as well. So draw on skills that we have managed to get through life's adversities in the past and recognize how did I deal with my emotions in the past and what were my supports and how can I utilize those in these difficult times now. And the other one is by the Hope Center, which is based up in the Aspen and kind of mountain community in Colorado. And they have helpful things as well, just staying informed and focusing on your resiliency and coping strategies as well. All right, so we're gonna go ahead and do our next poll. and really trying to find out, what do you find to be the best supportive tool for you?
Okay, same thing. We've got a lot of responses coming in, so I'll just give it another minute here. Okay, I'm going to go ahead and share. Can you see the responses, Alex?
I can't.
Oh, okay. Let me try one more time.
Okay. Oh, there we go. Okay. So on this one, we had kind of a range, which is great. Majority of people said they have healthy self-care habits, which is wonderful. That's great to hear. We also had a lot of people saying that they limit their exposure to information and media, closely followed by connecting with others. Others are doing a good job with routine. And then a few people are using breathing and grounding exercises. So that's great. So yeah, just kind of recognizing these are a few supportive tools that we have. If you're noticing that you are struggling and having a hard time, maybe trying new things or setting new boundaries can be helpful, or trying a new self-care activity. All of that can be really helpful to deal with this challenging time. All right. One thing to note, this is just a tool that we can utilize if we do have concern about somebody. Makes it a simple way to have difficult conversations if there is concern. So what we like to do is, one, use a language of care and concern. So we're just talking about what we notice or the concern that we have or what we're seeing. And then we're going to follow with, a request or a hope or something that we would like them to do because of what we've noticed. So we can think of this in three parts. You can have a green light, yellow light, and red light. So green light is there's no real safety issue. We just want to let people know that we care and we're there to help them if they need it. So an example could be, I've noticed a little bit of a change in your mood lately. I want you to know that if you have something going on or if you're struggling with something, that you can always reach out to me, and I'm more than willing to help figure out some resources or some things that you may need. So we're just kind of putting feelers out there, letting them know that I care and that I'd like to support you. Yellow light is you're not necessarily sure, but you're consulting and strongly encouraging. So maybe noticing some concerning things that you really want them to get some help. So you can say, I've really noticed you seem really disconnected even with the time that we're in, and you've also said some concerning things. I really need you to contact the EAP with me just to make sure you're getting the support that you deserve. So we're really kind of taking that next step of, we need to get something in place to make sure you're doing okay. Red light is there is safety issues. We are concerned about their well-being, and that's where we're really needing them to do something. So we say things like, I've been seeing lately that you've been saying some really scary things and really isolating yourself more than even with what's going on. I'm going to have you call the EAP, or I'm going to have you call the crisis center. So really saying these are what we need to do in this time period. So just language that we can use that can be helpful, because I think this is a lot of times where we get a hiccup of like, well, what do I say, or how do I address this? And this is just a simple tool that we can utilize to help with that. So this is what I think is one of the greatest things, is right now we have an abundance of resources around COVID. So I'm going to go through some of the ones that I think are the most useful and helpful. So we have the typical stuff that we're hearing, right? We have the CDC, which is a great way to get information. Same with the World Health Organization. They also have great documents on distress and coping and how to support kids. So check them out for sure. Absolutely check out NAMI. I have been blown away by this document that they have put together. NAMI is the National Alliance on Mental Illness. They have this whole document of resources that like I said, I just think it's great. They talk about what are resources, I'm feeling isolated and lonely, where can I go? And they have tons of websites of where you can just connect with people. So if you're living by yourself and feeling really isolated, there's tons of groups that you can check in on and get support around that. Or if there's insurance issues, or if people have been laid off and are needing some support around that. So this document, I think, can be really helpful. Same with SAMHSA, they have great information of how to get support and help as well. So really great information in all these documents. And then there's these as well that I think are more just informative. The University of Colorado, as well as the University of Denver, have put together a ton of information around COVID. The University of Colorado, they even have like a list of things to do with your kids, or where to get support. They have stuff for current students and for parents and community members. Same with the University of Denver. I think at 10 o'clock every morning, they have like a dance party for kids. So there's a lot of different resources and a lot of access there. And so just scrolling on their websites can be helpful. For employers, the Center for Workplace Mental Health has put together a really great kind of two-page document on what we can do to support. A lot of it's kind of what we talked about, but how we can support our employers and how to check in and how to address that. And then this last one is the document I was talking about earlier. It's the National Association of School Psychologists, but they have this resource that really helps of, how do I have this conversation with my kid? What if they are a 7-year-old, or what if they're a 17-year-old? So they can be helpful. I've also heard PBS has some really great documents as well for parents. So just some of the resources that we have. And that's one great thing that's come out of this is I think people have come together to see how can we best support each other and put some wonderful resources together like these. All right, so we're going to do one more poll. I want you guys all to respond. What resource has been the most helpful for you during this time?
I'll give it one more minute here. Okay. Can you see the results?
Yes, I can. Thank you. I wish with the poll we could have gotten with the other, maybe after we're kind of done, it'd be great to hear what resources they have maybe had. 60% said they're utilizing the CDC, which is great. 6% the World Health Organization, 3% SAMHSA, 2% NAMI, and then about 30% of other. So, like I said, I think it'd be great if for some of you that have had really wonderful resources that they're reaching out, this is a great way that we can share information. So if you have resources, please share them. I think it's always great to learn from each other as well. So, and like I said, those are kind of a compile of the ones I have found to be the most helpful, but I know there are others out there that are really trying to help our communities best, recognize what we can do around this trying time. All right. Right, Lily, I'm going to turn it back over to you at this time.
Sounds good. Thank you, Alex.
Yeah.
Well, we have received a lot of great questions in response to the information you just presented. I think one of the things that remains front and center is just how different the situation is for every individual. And as far as the stressors that they're facing, whether it be financial or having a family member who's sick and not being able to connect with them, juggling, as you mentioned, a lot of the work demands and expectations that have come along with this, security issues around job stability. So you mentioned, I want to kick the discussion off with a question that I have. You mentioned control and really focusing on having that internal locus of control. And I'm wondering if you can speak to whether or not there are certain groups that are more at risk and what coworkers and managers can do to really be attuned to those at-risk individuals.
Yeah, so, the hard thing is we're kind of learning as we go what puts somebody at a higher risk. But one thing you just kind of common sense can think of is isolation. Those who are really isolated more, whether they're single or maybe they're new to their job or new to their community. So people that may be really isolated in this time, further than what we already are, that can be a higher risk issue, as well as people who have mental health issues or already existing mental health issues and what impact this can have. We kind of see a range there. I heard another doctor mention how some people with anxiety are actually saying now, like, see, this is what it feels like this is like, welcome to my world, and not necessarily being as anxious themselves, but seeing how other people are becoming that way. But it's also hard because we may see that people who have never been affected by that are going to come out of this and have some more mental health issues or have different responses. But by far, I would say if we're noticing that further isolation or really having isolation just within their circumstances as is, those are definitely times that we want to be checking in and making sure there's support for those individuals, as well as if we know there's underlying mental health issues, to make sure they're still getting the services or treatment that they were getting beforehand.
Great, thanks. And that's a great segue into one of the Q&As we've received from a participant. In regards to individuals who are in human resource positions, the question is, how do we provide tips and training to support employees without veering into clinical territory or HR issues? So what type of information is appropriate?
Yeah, so I think one, really letting people know what services you are able to offer through your company. So whether that's doing a deep dive into your EAP or insurance, breaking that down. People may have never had to utilize the services you provide and maybe don't even know where to go. Even when we weren't in this, I was always surprised with how many people didn't really recognize what benefits they had. So doing just a recap or doing even just like a webinar of a reminder of here's what we have access to, here's how you utilize it. That can be really helpful for people who maybe have no idea. Even some of those resources we mentioned, just giving documents out like that, whether people are showing signs or not. I think the more that we open up conversations for this, the more people will be willing to get that support that they may need.
And as far as training goes, we've had a couple of questions pop up about limitations in technology and making sure that these resources are being inclusive and providing supporting communication and communication services. Do you have any tips on online programs that can be delivered for stress reduction or mental health, suicide prevention in different formats?
So it's a good question. I know that NAMI document has a lot of great resources on it in terms of what people, and if you go to that document, you can click on some of the opportunities that they have. We are also, the Depression Center will also offering a range of, they are trainings, but we can do a range of talks, whether it's stress management or self-care. But that kind of comes into, we do those through Zoom. But really, I think seeing what NAMI has, I think would be a good opportunity if you're looking for something unique or a little bit different and how to gain that access. I don't have it pulled up right now, but in terms of online learning or educational opportunities, I know there's a lot that's offering free kind of educational opportunities to connect. I just need to scroll through my email and I can send that to you.
Great. Great. And just as a reminder, we are sharing the slides. This will be recorded. So for sharing resources, we'll make sure to get those all to you. There's a great question that came in from an attendee who is on the front lines and working in emergency preparedness for a health department, and finding it really difficult to avoid information overload because of the need to have that be a part of their job. What would you recommend in that situation?
Yeah, that's hard, right? Because you're inundated in it and you don't have the choice. But absolutely, when you are not at work, you have to disconnect. It can be really easy to sit in bed at 11 o'clock at night and be checking your emails or checking in and doing that, but you have to find time to disconnect, and whether that's getting outside or doing an art activity with a friend, or doing a girls' night or guys' night on Zoom, and not talking about this, having to find, even if it's little spurts, but we have to do that to really protect our own self-care and mental health in general. And we talk about that just in self-care, without this going on, is we are actually more productive, more creative, better problem solvers, better at our work when we focus in on self-care and disconnect from our work, instead of just constantly being flooded with it. So when you have the time to disconnect, make sure you're doing that.
Thank you. Another question came in, and I can relate to this one too, as it's, much of my stress around COVID is in relation to family members and friends who are not taking recommendations seriously. How do we handle these sorts of conversations without straining relationships and causing more stress?
I think that's, again, and the CDC mentions this, and so does the World Health Organization, but you share facts. I think a lot of people are using scare tactics, which obviously, has an impact on some, but what we're seeing is it's actually just scaring those who are already scared even more. And so really sharing facts of, this is what our resources are telling us. This is, what we really want people to be doing to make sure that we're all safe. But we also have to recognize, for our own mental health, we have to learn our own boundaries of, they have the information, I've told them what I know and what resources I have. And at some point I have to just take care of myself, my family, and do the best that I can. Because if we do get so focused on that, it's going to end up draining us and really have an impact on our own health.
Really important reminders. And I also think it's going to be interesting to see how a lot of this translates into back to normal and return to work. I read something this morning that really resonated for me. It said, global catastrophes change the world. It will change the way we move, build, learn, and connect. There is simply no way that our lives will resume as if this had never happened. The emotionally and spiritually sane response is to prepare to be forever changed. I'm wondering if you can comment on that as far as the long-term impacts of the pandemic on mental health in our society.
Yeah, so I think it's an important point, right? We're not going to come out of this and act like it never happened. It is going to have an impact on all areas of our life, and absolutely our mental health aspect. And so I think one is just recognizing, especially in your careers or in your work, is even if an employee left, totally fine and we had no concerns about them, they may come back with some concerns coming up. And so even more of an importance and stressor to recognize, how can I keep continuing checking in and having feedback loops and having open conversations as this is going on and even afterwards. I think also you kind of mentioned this kind of, how do we prepare for this, is having these conversations now of, what is work going to look like? What are some challenges that we're going to come across? How can we best support each other? So I think it's one, just having that on the top of your mind of how do I best support my employees or my coworkers, because things are going to be different, and recognizing that things may not, that the person who showed up, you know, in March may look different when they show up in June or July or whenever that happens. So recognizing that, having our antennas up to recognizing those changes and how it may present in each person. But then also seeing how can we focus on the positive. So again, recognizing that resiliency piece of how do we get through things? How do we cope? How can we, you know, create a work environment where we are focusing on that positive, but also recognizing how can we support those who may be struggling.
Thank you. Last question to wrap things up, and this is a great one to end on. The question is, how do we get back on track? So you just mentioned that a bit. And the feeling of this being all-consuming, and however our jobs have taken a back seat in some situations, in certain instances, it's been an opportunity to be able to respond to this for a lot of organizations, but how that can translate into stress because of feeling like you can be more productive, or even, as you mentioned before, being able to manage expectations now might have consequences when we return to our normal work arrangements or situations. So the question as far as how we get back on track, do you have some tips as far as maintaining short-term versus long-term vision around this?
I mean, I guess the hard part about that is each organization is going to have a different, each employer and employee is going to have a different kind of trajectory of how that will look. But I think the important thing that we do have to remember is we are all in this together. It's not just your company dealing with it. It's not just you. This is something that we are all having to handle and have to make these changes. Again, having that transparency and those conversations up front of this is how things look now. It may be ever changing day to day now. These are the expectations we have when we get back. What is realistic? What is unrealistic? How is that transition going to look? I think the hard thing about that is we don't know when that transition back is going to be, but we also don't want it to come that, you know, May 1st hits and everybody says, let's get back. And we're like, oh, we haven't even thought of how this is going to play out. So even though it's unknown, having conversations about that now and having boundaries and talking about boundaries and expectations as we transition, I think is important to have those open conversations now.
Thank you. And I just want to acknowledge those that have shared personal comments in our chat room as far as having family members that are directly affected or on the front lines and how stressful that can be. And I think that speaks even more to the importance of empathy with your friends and families, family members, as well as your coworkers. And also for supervisors out there to continue to check in with employees on this situation and how they're personally affected as it relates to work and expectations. So Alex, thank you so much for your time and for sharing this information. I anticipate there's going to be more opportunities to invite you back to present to our network as this develops, but this has been fantastic to be able to share these resources here today. Next week for everyone, I want to let you know that our next town hall meeting is going to be with Dr. Alex Reed on managing depression and enhancing well-being. Alex Reed is the director of Director of Behavioral Health Education at the University of Colorado Family Medicine. He's also the team psychologist for the Denver Nuggets, and he's going to be presenting on learning signs of depression during stressful times, but also really focusing on some tips for boosting mood and really navigating isolation. So please join us. We'll send out a link. And I actually think Katie's put that in our chat box here today. But after this, you'll receive the link to the recording and the slides and the registration for next week. And we encourage you to share this with your network. So other people in your organization or any interested party, please feel free to share these resources. And then I'll leave you with a parting thought that reflects what Alex shared here today. As far as something daily you can take into your own practice when you wake up and running through your thoughts and really reflecting today how you feel, your energy, I feel this way because, and where you want to focus your attention to be my best, I will focus on. And I found this to be a useful practice for myself and to share with others. So please stay connected. I've listed links to our website, our newsletter, and our social feeds. And I hope to see you again next week. Thanks again, Alex, so much. And to all of you who took time to join us today, be well, and we'll see you soon.
Thank you.